I'm Dr. Raymond Dr, Beverly Hills, California, and welcome to another segment of Thyroid Thursday. Today we're being joined by our expert and a friend, Dr. Babak Larian. And Dr. Larian is an ENT surgeon. In fact, he is the chief at Cedars-Sinai Medical Center, the chief of ENT, and has a private practice here in Beverly Hills and Los Angeles, and specializes in thyroid and parathyroid surgery. Thank you so much for joining us.
It's a real pleasure. Thanks for having me.
You bet. And so what we want to talk a little bit about today is what is hyper and hypothyroidism, and what does that mean as far as your test numbers? Those crazy numbers that patients get and don't really know what they mean, the TSH, the T3, the T4. But also, what is Graves' disease and Hashimoto's disease, and are really they the same as hyperthyroid and hypothyroid? Because there's a lot of confusion, and then the answer is it's kind of a complicated answer. So we'll first start with what is, hyper and hypothyroidism, and then we'll get into what is Graves' disease and Hashimoto's disease.
Right. So hyperthyroidism is when the thyroid gland is producing too much thyroid hormone. Hypothyroidism is when it's producing too little. And the reason that happens is because there's a very fine control of thyroid hormone production in the body. The brain has a gland that produces the hormone, thyroid stimulating hormone, or TSH. That hormone goes to the thyroid gland down here, which causes the gland to produce T4, the thyroid hormone. And T4 gets transformed into T3, which is the activated form of the thyroid hormone. And that's what causes the body to modulate and adjust the metabolism of every single individual cell in the body. So the thyroid plays a very important role. And the control of those levels are very finely done by the brain, measuring the amount of hormone in the body and making sure it's always appropriate. In someone who has normal thyroid numbers, the TSH is in the normal range, the free T4 and the free T3 are in the normal range. And so when those numbers are in the normal levels, then you can be assured that the amount of hormone being produced by the thyroid gland is appropriate, and the brain is monitoring it closely and seeing it. In a hyperthyroid state, what you have oftentimes is a free T4 or a free T3 that's elevated, or a combination of both of those, and a TSH that's low. Because when the T4 numbers go up, normally the TSH goes down. The relationship is inverse. And when the TSH numbers, when the T4 numbers are low, the brain recognizes that there's not enough thyroid hormone in the bloodstream. It increases the thyroid stimulating hormone and tells the gland to produce more hormone. Right? So if your thyroid is malfunctioning and producing too much hormone, and you have too much, the TSH will be low. And so low TSH, high T4 is a hyperthyroid state. On the other hand, when you have a hypothyroid state, when you're not producing enough thyroid hormone, your T4 and T3 levels will be low and your TSH will be high. So the relationship is inverse. Now if it's within the normal range, that's a fine-tuning and adjustment going on, but when the numbers get out of range in either direction, that indicates either a hypothyroid state or a hyperthyroid state. Now,